Hello and namaste, guys. I am Dr. Anushruti and I am back with yet another splendid episode. Today on board, we have Dr. Neil Sheth, who is a sports physical therapist and a performance coach who is on a mission in erasing limitations and elevating performance. He is joining live straight from Virginia. Hi, Neil. How are you?
I'm good. How are you? Thank you for having me on.
I am fine. This is my pleasure to have you on board with us today. Well, starting with the very first question, since you specialize in sports physical therapy, what exactly is the role of physical therapy and physical therapist in sports?
So, physical therapy, I think, can be argued two ways. Most people will say it's addressing pain, but I don't think pain is the only thing that you need to see a physical therapist for. I also, especially in the sports world, limitations as far as, hey, I can't move my hip as far as the other side, but it's not painful. I think seeing those kind of things is a reason to see a physical therapist. And then the transition into sports is that it's just at a much higher level, right? Higher speed, a lot more forces, a lot different kind of positions you're in just because of the nature and the chaos of sports. Um, so I would say that's the big difference.
Yeah, totally understandable. Also, what are the benefits of getting trained under a physical therapist while being in sports? Like, we do have a lot of sports person right here in the audience listening and watching us right now. So you would always suggest them to have a physical therapist for them. So what are the benefits they are going to get if they do have a physical therapy session regularly?
Yeah. So, in my experience, when I was in Texas, I worked with a semi-pro team, a football team, American football. And they would get weekly sessions with me to, right after any kind of game, it's very demanding on the body. Um, Depending on your sport, you always wake up some with aches and some pains. So having a physical therapist on hand or one that you can see regularly, like in that kind of sense, or talk to, can help address like, hey, is this something I need to get checked out? Can I do a couple exercises at home? Do I need to take myself out of the game? Do I need to come see you? So they can answer any of those kind of questions. And also being on that performance side, a lot of guys in the football team would kind of train in a way that was probably more harmful to their performance, right? Kind of doing way too much in season. So it's kind of my job to be like, hey, you need to cut this back, or this is the day you need to squat or deadlift, and this is the day you can do upper body, and this is the day you need to rest before the game so you can perform at the best level for the team.
Okay. And is there any specific sports? I mean, we do have a lot of generalized audience as well who do not know typically about physical therapy and its specialization in different forms like respiratory care and cardiopulmonary care. Since you specialize in sports category, is there any special kind of sports that require physical therapy, or any sports person can have physical therapy sessions like it is needed for them?
I think finding a provider that works with your sport specifically is definitely going to be a bit more helpful. As in, they'll know usually. So in my experience, I played football, I played basketball. So knowing the ins and out as far as an athlete side kind of gives you a better understanding of the sport and what the position may need or what the game kind of flows as versus so I've worked with some rock climbers and I've kind of done rock climbing recreationally, but they'll teach me a lot of different terms or techniques that they have to get into. And then it's challenging to try and figure out, okay, how am I gonna help their shoulder be non-painful or unlimited in this kind of grip position?
With that, strength training also is a core part a physical therapist can help in them.
Oh, strength training in rehab.
Yeah, I mean, if you are a physical therapist in sports and you are training a team or a typical sports person, you can help them out in strength training and injury prevention too,
Yeah,
specifically.
so I think a good phrase is a good injury prevention program is also a sports performance program. If you're kind of
Yeah.
training, yeah, if you're training the tissues well for the demands that you need, you'll also likely prevent the injury or reduce your risk of having one.
Cool. Neil, we have always come across two words, that is rehab and performance. Like these two terms are so, they are used so frequently in our career, in physical therapy, and basically in sports as well. So, what is the interrelation between rehab and performance?
Yeah, and I think that's a really good question. I think a lot of people have trouble defining that line. And I don't really think there is a hard line. I think it's much of a gray area as it can be. There is at some point where the athlete or patient needs to see their coach or a specific position coach. But the realm of rehab or that scale of rehab performance, I think, starts at maybe an injury or limitation where you're taking someone out of the game or limiting their participation in their sport and addressing those things in the clinic. And then the grade gets into, you're starting to load them, you're starting to have them run and jump again in the clinic first. And like, okay, you can try this on the field now. And you're communicating with the coach or the trainers with that team. And then becomes a little bit more performance side, right? As you start doing those higher impact things like the running, jumping, the weights. And then it gradually just blends into that performance side.
Totally. And moving ahead with this, Neil, you are aware about isometrics. I'm aware about isometrics. All the physical therapy students and physical therapists are aware about isometrics. But isometrics is a term used frequently, but is not known by a lot of people. What exactly is isometrics? And when they get to know what exactly is isometrics, what they believe is, what? This is isometrics and it has such a big name, isometrics. So please explain the term isometrics for our general audience, our patients and our clients listening and watching to us right now.
Yeah, so technically speaking, isometrics is a contraction of the muscle without any change in length. The easy way I tell people is if you go in the middle of a door or between a door and you try to push against the door sideways, right? You're creating a lot of effort trying to move the door, but you're not moving. That's an isometric. And then it can
A
get into two
great
different.
example. This
Yeah,
is a
that one's an
great
easy one.
example.
So that there are two types of isometrics. It's that one, and then an overcoming isometric, where like in my clinic, we'll have people set up with a barbell against the spotters. So the spotters won't move, but you're gonna pull into that as hard as you can without creating any movement. But you're creating as much force as you can. And the other one can be like typical isometric is just holding a position for however long.
Okay. I believe all the audience who's listening and watching to us right now, who have ever been to a physical therapist in their lifetime, or you would have come across these terms, isometrics, on Instagram and various other coach, their pages, their Instagram pages. So I do hope that Neil has cleared your doubt that what exactly is isometrics. Moving ahead, Neil, what are some basic ways to prevent an injury? Like a very basic way to prevent an injury that one should actually know. We can say the first aid of preventing an injury.
You know what, with the population and the people I've seen that I work with, one of the easiest ways is if you're going to be active, is that you have a really solid warm up. It's not just a couple, let me grab my leg, do a couple stretches, and then just go out and go. I have a 3-level system as far as warm-ups that I put my athletes through, depending where they are in their care. But it's just enough to warm up the tissue, mobilize the tissue, get them ready for the demands of our session. So I think having a solid warm-up every session before you're working out or going for an activity is probably the easiest way.
Okay. With this is the time of question answers. So Neil, let me introduce to you with this segment in our show, which is actually answering questions of my followers and viewers who have already sent me a few questions regarding you. So the first question coming up on your way is from Miss Radhika Patel from Maharashtra, and is asking, okay, a great question on physical therapy, sports physical therapy, basically. So Miss Radhika Patel is asking me that my son is in a football team in his school in class 3. So in the his son, her son is in third grade, and he is in a football team. So he has a physical therapist in their school, but for them, for the sir, it is difficult for them to handle kids. Okay. I would say that her question is that her son is in third grade football team, the small tiny tots football team. So they do have a physical therapist for them for injury prevention or that emergency care. So how do they actually, have these ideas to play with the kids and help the kids in this prevention?
Ideas as in what are they doing?
Yeah, the physical therapist view, like how do they take care of the students?
Yeah.
Because
Well,
pediatrics, physical therapy in pediatrics, geriatrics are the two core parts which needs a lot of training.
yeah, and then right going into pediatrics, I think so. I work with youth athletes now in Virginia, a lot of youth
Yeah.
athletes. And in Texas, where I was previously, youth athletes and parents would push their kids so hard and do so much where you're at a developmental age where you don't really need to be doing that. Usually at the time for males, at the time of puberty, you hit this curve, right, where you're growing really fast. That's usually a time you want to start weight training, introducing some of those loads. But anything younger than that, you really just playing and being active and moving is, and having games really for kids that young is plenty of what they'll need. Being involved in a lot of
Okay.
sports too.
Great, greatly answered. The next question is from Miss Gayatri from Kerala, who's asking that she has no interest in sports but wants to do sports physical therapy just because of its scope.
As a profession,
Yeah, as a profession.
I mean, I think that's a great idea. So I would say in the States, we have two different big residency directions or specialties. It's orthopedic and sports.
Yeah.
Um, Usually the big difference with sports physical therapy is during the process of gaining that specialty is you have to do a lot of on-field hours. So it's a lot of time outside of the clinic, late nights doing things that you probably don't want to do, right? On like a Friday night, being out until 11 o'clock, just covering a football game. So I would say that would probably be a really big consideration. If you're not interested in sports, that may deter you. Orthopedics is really good as well, right? You learn about the body in such a deep, detailed way. The big difference is the sports aspect and the on-field thing.
Yeah. So, Miss Gayatri, I believe your answer would have got answered. A question would have got answered. Neil, I would like to introduce with another segment of this show that is motivation, a token of motivation and appreciation for all the aspiring doctors listening and watching us. This time is really difficult for them. I mean, this is a time which requires a lot of hard work from their side, and sometimes it really becomes difficult to cope up with this. They have plenty of thoughts, random thoughts. So each and every doctor who comes to my show always tells them, gives them, a piece of motivation, suggestion, and inspiration. So some wise words from Dr. Neil Sheth for the aspiring doctors listening and watching us right now.
Oh man, you put me on the spot with that one.
I mean, you would have gone, I mean, that is a pretty sure thing that you have also come across these things when you were a student in your lifetime. So maybe your personal experiences, that what mistakes you have learned from.
Yeah, I mean, I think there's a few I can draw back on working in with my residents. One of the big ones was just leave no doubt, right? You work as hard as you can. It'll always be worth it. But you don't want to leave any exam, any grade, anything to doubt. If you could have done more, you can definitely achieve it. You can do it.
Definitely, definitely. With this, we come to the end of our episode. This was so, so, so splendid. Thank you so much, Dr. Neil, for joining in and taking out time from your schedule to have some words with us and with our listeners and viewers. I do hope you enjoyed it as much as we had listening to you.
Thank you for having me. Always available to answer any questions if anyone has. I'm very active on social media if you guys want to reach out and have more questions.
Definitely do give him a follow on every other social media app he's available on. Also, this is your reminder to straighten your back, have a good posture, and take care of yourself. We'll meet in another video, another podcast. Till then, see you guys. Take care. Goodbye.